Hello, welcome to Renal Dose, small doses, large clearance. In this series, we'll talk about renal transplant, and today we'll talk about when to refer for transplant. See, kidney transplant is the best renal replacement therapy right now, but only if we refer patients at the right time, because a lot of the outcomes are decided by when the patient actually receives the transplant. You don't want to wait for too long because even on dialysis, patients will have irreversible effects on almost all the systems of the body. Hence, transplant is always better than being on dialysis. Any patient with progressive, irreversible chronic kidney disease should be referred for transplant evaluation. If we go by staging, referral should begin when the estimated GFR falls below 30 ml per minute, that is CKD stage 4. And at a GFR below 15, referral is no longer optional, it becomes mandatory. Most patients with progressive and irreversible kidney disease will end up as end-stage renal disease, and a majority of these patients will land up in hemodialysis. This is not ideal. Ideally, all patients should be given an option for renal transplant. Any renal transplant performed before going for dialysis is called preemptive kidney transplant. But a majority of patients first go for dialysis and then go for transplant. Preemptive transplantation offers superior outcomes compared to post-dialysis transplant in terms of better graft survival, better patient survival, and significantly fewer complications. Now, if we compare the survival on dialysis and after transplant, we'll see that after transplant the 10-year survival is roughly 80%, whereas comparing this to remaining on dialysis, survival is at around 10% or so. So there are clear benefits. Now, despite these clear benefits, several common mistakes delay transplant referral, such as waiting for dialysis initiation, waiting for fistula creation, assuming that age and comorbidities are a contraindication. That being said, there are actually some absolute contraindications to kidney transplantation, and they are active infections, active malignancy, not past malignancy, but active malignancy, severe irreversible cardiopulmonary disease, active substance abuse, psychiatric illness, and limited life expectancy are some of the few. But if none are present, go for transplant. Always remember, early referral saves grafts, saves lives, and avoids unnecessary dialysis.